An implant is an excellent way to replace a missing tooth and keep a good-looking smile. A dental implant is a small titanium cylinder that's surgically inserted into the bone of the jaw to replace the root of a missing tooth. An artificial tooth is attached to the implant. Placing a dental implant after a tooth's been lost can prevent a chain reaction of problems that would affect your entire mouth. Teeth need each other for support. When a tooth is lost, the biting forces change on the teeth next to the space, and they shift. When a tooth no longer has anything to chew against, it begins to extrude out of the socket. You can eventually end up losing it too. When your bite is slightly off, it's common that one tooth may hit sooner than the rest. This causes undue stress on the involved teeth, and they begin to flex. It is this continual flexing and stress over time that causes the enamel to separate from the inner dentin layer, forming the familiar-looking notch that we call abfraction. As your bite changes, it gets harder and harder to chew your food, and you may get damage to your jaw joint, the TMJ. It's much harder to clean teeth that have shifted. Harmful plaque and tartar collect in these new hard-to-reach places, causing cavities and the permanent bone loss that comes with gum disease. A bridge is another way to solve the problem of a missing tooth. But two advantages of an implant over a bridge are that the teeth next to the space aren't affected, as they are in this bridge prep, and the implant helps stop the ongoing bone loss that occurs once a tooth has been lost. A missing tooth really changes a person's smile, but a dental implant can replace the missing tooth and improve your smile. Restoring your mouth with a dental implant is accomplished in two phases. The first phase of the procedure is the surgical placement of the implants. They're under the gums for several months while the bone attaches to them. After healing, the second phase begins. The implant is re-exposed and your new crown is made. For the surgical placement of the implant, your mouth will be numbed. An incision is made in your gums and a channel is made in the bone to receive the implant. After the implant is snugly in place, the gums are closed over the implant with a stitch or two. Over the course of the next few months, the implant becomes securely attached to the bone. The second phase starts with surgical exposure of the implant. Another incision is made in your gums, and a small extension is placed to bring it above the gum line. We then start a series of appointments to make your new teeth. Though some of the steps might be different in your case, they usually include making impressions of your mouth. From these impressions, we make precise working models of your mouth, which are carefully mounted for proper alignment. The last step is the placement of your new crown. The success of your implant depends on your care of the implant at home and our support through regular checkups and cleanings here in our office.